your student nurse today. How are you?
Great, thank you.
Good. Robin, can I have you verify your name and date of birth?
Robin Bishop, 9/30/65.
Perfect. I'm just going to take a look at your bracelet, make sure I have the right patient, and I do. Robin, I'm going to pull this curtain for some privacy. And what we're going to be doing today is we're going to be doing a head-to-toe assessment, okay? I'm going to use my stethoscope that I've already sanitized, and I'm going to be listening to certain parts of your body. I'm also going to be using my hands that you just saw me sanitize. I'm going to be pressing on certain areas of your body as well. And I'm going to use my pen light that I've sanitized to look into your eyes, okay?
Okay.
All right, and so before we begin, I'm just going to take a general overall assessment of the area. I notice that you're in a low, safe position with your call light. You don't have any IVs, and there's no respiratory equipment that we have to be aware about, so we're in a safe area. All right, Robin, I'm just going to be asking a few questions. I know they can be kind of personal, but if you can be open and honest, that would be great, okay?
Okay.
All right, Robin, how have your moods been lately? Any changes?
No.
Okay, any depression or anxiety?
No.
Any thoughts of hurting yourself or others?
No.
Okay, and then do you feel safe at home?
Yes.
All right, Robin, and then I'm just taking a note. I can see that you're well put together, well groomed. There's no sign of disheveledness, and there's no sign of abuse. And then, Robin, can you remind me who I am?
Amanda, the student nurse.
And who are you?
I'm Robin Bishop.
And where are we at?
We're at the medical center.
Okay, what are we doing here?
We're doing a head-to-toe assessment.
Okay, and then can you tell me the date?
It is November 14th, 2021.
Perfect. I'm going to just note that you're alert and oriented ×4. And then, Robin, have you had any changes to your sleep patterns?
No.
Okay, any dizziness?
No.
Any headaches?
Yes.
Okay, and then do you see a neurologist for your headaches?
I do.
Okay, and are you happy on that course of treatment?
Yes, I am.
Okay, perfect. And now what I'm going to have you do is I'm just going to have you take your 2 hands and I'm going to have you squeeze my 2 fingers as hard as you can. And I'm just going to note that you have equal strength in both your hands bilaterally.
Okay.
And then I'm going to have you push up on my hands like you're doing a bicep curl. All right, pull down. All right, and then push out with your legs, please. And then back. All right, I'm just going to note that you have equal strength in all extremities as well. And then, Robin, now what I'm going to do is I'm going to ask you to take your glasses off, and I'm just going to put a light in your eyes, okay?
Okay.
And I'm just checking your pupils. I'm going to cover your eyes. And I'm just going to note that your pupils are equal, round, reactive to light, and accommodating, which is what we like to see. I'm also going to take my hands and I'm just going to press lightly on your sinus area, okay?
Okay.
Are you having any pain when I do that?
No.
Okay, perfect. And then I'm just going to take a look at your eyes and I'm just going to note that there's no signs of redness. Your conjunctiva is pink and moist, and then your sclera is white. There's no sign of debris or drainage. You can go and put your glasses on if you're comfortable. Robin, now what we're going to do is we're just going to take a look at your scalp. I'm just going to note if there's any debris or if there's any open lesions, okay?
Okay.
Okay, so I'm going to put on some clean gloves. And I'm going to look in your scalp, and I'm just noting that you have a clean scalp. There's no sign of debris. I don't see any visual lesions or masses. Do you have any concerns with your scalp?
No.
Okay, I'm just going to kind of feel on your scalp. Do you have any tenderness?
No.
All right, and so I'm just going to note that I don't palpate any lesions or masses. And then, Robin, now what I'm going to do is I'm just going to check your ears, okay?
Okay.
All right, I'm just noticing that the patient doesn't have any drainage or redness from the ears. And then, Robin, when I touch your ears, do you have any pain?
No.
Okay, and then can you feel me rubbing or hear me rubbing my fingers together?
Yes.
Okay, awesome. Thank you. And then have you been having any vision changes?
No.
Okay, and then I'm going to have you just put your head up. I'm just going to check it in your nose. I'm not going to put anything in it. Just look, and I'm just going to note that the patient's mucous membranes are pink and moist. There's no debris in the nose, and I'm going to note that the patient's septum is not deviated. I'm going to look in your mouth as well, okay?
Okay.
All right, and I'm going to note that the patient's mucous membranes are clean, pink and moist, excuse me, and I'm going to note that the patient has good dentition. And then, Robin, do you see your dentist every 6 months as recommended?
I do.
Okay, perfect. So now, Robin, I'm just going to do a respiratory assessment. So I'm going to be taking a look at your chest and your back. Okay, and I'm just going to note that the patient has no unlabored breathing. And have you ever had any shortness of breath?
No.
No, okay. And then I'm just going to feel around for any masses and lesions, okay?
Okay.
All right, and then I'm just going to note that this patient does have a scar on her back. Do you have a scar from a recent surgery?
Yes.
Okay, perfect. And I'm noticing that even though I didn't see any lesions, I'm not feeling any masses or anything, and I'm noticing that her AP to T ratio is 1:2. And then, Robin, now what I'm going to do is I'm going to put my hand over your throat, and I'm just going to ask you to swallow lightly, okay? And I'm just noticing that the patient's trachea is midlined. And so now what we're going to do, Robin, is I'm just going to take a listen to your lungs, okay?
Okay.
All right. And normally I would listen to all lung fields for an entire respiratory cycle, but for the sake of time, we're just going to show proper placement. All right, Robin, then I'm going to go to the back and I'm going to do the same thing, and I'm just going to have you kind of turn to the side.
Okay.
And again, I would listen to all lungs field for a full respiratory cycle, but for the sake of time, we're just going to do proper stethoscope placement. All right, Robin, I'm going to note that your lung fields are clear in all areas. And so now what I'm going to do is I'm just going to listen to your heart, okay?
Okay.
Ever had any chest pain, discomfort, tightness?
No.
No? Okay, so I'm just going to listen to your heart. And I'm also just noticing patient's overall color of her skin and that there is no signs of cyanosis. All right, and I'm going to be listening to the aortic valve, pulmonary valve, tricuspid valve, and then the mitral valve. And then I'm going to take an apical pulse for a minute. For the sake of time, we're not going to do it for a minute, but your apical pulse is 76, which is just within normal limits, what we like to see. Okay. All right, Robin. Now I'm just going to do an overall assessment, and I'm just going to note that your skin color is normal. There's no signs of cyanosis. I'm just going to use the back of my hand. I'm just going to touch on your skin, and I'm just going to note that the overall temperature is normal. There are no areas that are hot to the touch or too cold to the touch. And then while I'm looking, I'm just going to note that the patient does not have any edema in the lower extremities. And I'm going to take the pulses on the top of your feet, so I'm taking some pedal pulses. And then I'm just going to pinch your toenails here, and I'm just going to note that the capillary refill is less than 3 seconds, which is normal and what we like to see. And then I'm also going to take your pulses on your radial pulse right here. And I'm just going to note the rate and rhythm, and I'm just going to note that the patient has normal rate and rhythm, and that's equal in both radial pulses. And then I'm also going to do a capillary refill test here, and I'm going to note that the capillary refill is less than 3 seconds. All right, Robin, so now what we're going to do is we're going to check your tummy, okay? So I'm going to have you move over to the bed for me.
Okay.
All right, Robin, and then have you had any changes in your appetite?
No.
All right, any nausea, vomiting, or diarrhea?
No.
Okay, and so Robin, what I'm doing is I'm doing a visual assessment of the area. I'm noticing that the tummy is round, which is normal. And then, Robin, when was your last bowel movement?
Yesterday?
Perfect, okay. So now that I've noticed that the patient's stomach is normal sized, shape, and color, I don't see any visual lesions and I don't see any signs of hernia. Robin, I'm going to listen to your tummy now, okay?
All right.
All right, and normally I would listen into all 4 quadrants, and I'm going to do that, but I'm not going to do it for the normal amount of time just to save time. And I'm just noticing that the patient doesn't have any hyperactive bowel movement. All right, no hyperactive sounds. And then Robin, I'm just going to take my hands and I'm going to lightly press, okay?
Okay.
And I'm just feeling for any masses and lesions, and I'm noting that I don't feel any. Do you have any pain when I do that?
No.
All right, I'm just going to put a little more pressure here. If there's any pain, let me know.
Okay.
All right, and then Robin, do you have any vaginal odor, discharge, or anything like that?
No.
No. Okay, no burning pain?
No.
Okay, any blood in your urine or stool?
No.
Okay, perfect. And then I would do a visual inspection of the genital area, but for patient privacy, we won't do that. And then Robin, I'm gonna have you sit up for me. And then when you're ready, I'm gonna have you stand up and come forward a little bit. And then Robin, we're gonna do a musculoskeletal assessment. So I'm gonna have you put your arms out to the front and the back, to the side, and down back. And then same thing with your legs, one at a time, front, back, and then out to the side. And I'm just noticing that the patient has good range of motion in all extremities. All right, Robin, I'm just gonna have you walk forward a little bit, and I'm just assessing the patient's gait. I'm noticing that the patient has a good gait and that she is not leaning or veering to one side. Go and come back. And then Robin, I am going to have you just bend over and touch your toes as far as you can, and I'm just noticing that the patient's spine is midline. There's no signs of scoliosis, lordosis, or kyphosis. Then Robin, I'm gonna have you have a seat for me. And then I'm going to have you kind of do a bicep curl. Perfect. And then push down on me. Perfect. And then bring your legs out towards me and back. And then I'm going to have you press up against me on your feet and then press down like you're pressing on the gas. Awesome. Thank you so much. All right, Robin, and now what I'm doing is I'm just going to do a quick skin assessment. Again, I'm just noting the temperature in your skin, that it's equal throughout, that there is no signs of any redness, and that I don't feel that there's any temperature changes. It's not too cool or too hot. I'm also noticing that the patient's skin is dry and that it's intact, no visual lesions. The patient's not diaphoretic or overly sweating. Do you have any skin lesions, moles of concerns?
No.
No? Okay. And then again, I'll just take note of the patient's scar on her back. And then Robin, I'm just going to check the back of your hands, and I'm just going to pinch up the skin, and I'm going to note that the patient is not dehydrated. She has normal skin turgor. And then Robin, do you have any itching?
No.
Okay, any irritation?
No.
No? Okay. All right, Robin. Well, it looks like I'm done picking on you for the day, so I'm going to leave you in a low, safe position. I'm going to give you your call light. Do you have any questions or concerns?
No.
Okay. All right, Robin. Well, you stay safe. If you need anything, let me know, okay?
All right, thank you.
Thank you.